Top 25 Physiotherapy Assistant Interview Questions and Answers. Are you preparing for your physiotherapy assistant interview? Then this video is exactly what you need. In today's session, we'll go through the top 25 most commonly asked physiotherapy assistant interview questions, along with clear, confident answers that'll help you stand out. Whether you're applying for a hospital, clinic, or rehabilitation center, these answers will boost your confidence and show employers you're ready to make a real difference in patients' recovery. 1. Tell me about yourself. As a physiotherapy assistant, you should highlight your background, education, and passion for patient care. You might say, I'm a compassionate and dedicated physiotherapy assistant with hands-on experience supporting licensed physiotherapists in delivering rehabilitation programs. I completed my training in physiotherapy assistance, where I developed strong skills in exercise supervision, patient mobility, and documentation. I'm passionate about helping people regain independence and quality of life through movement and therapy. I enjoy creating a positive and motivating atmosphere for patients and pride myself on excellent communication and teamwork. 2. Why did you choose to become a physiotherapy assistant? A strong answer should reflect empathy and interest in rehabilitation. I've always been fascinated by how the human body heals through exercise and therapy. After volunteering at a rehabilitation center, I saw firsthand how physiotherapy transforms lives. That inspired me to pursue this career, where I can help patients recover mobility, reduce pain, and regain confidence. I enjoy working closely with people, motivating them, and seeing their progress day by day. Being a physiotherapy assistant allows me to make a meaningful impact every single day. 3. What do you understand about the role of a physiotherapy assistant? Show awareness of responsibilities and teamwork. A physiotherapy assistant supports licensed physiotherapists in delivering treatment plans designed to help patients recover from injuries, surgeries, or chronic conditions. This includes setting up equipment, guiding patients through exercises, observing progress, maintaining safety, and documenting results. We also educate patients on home exercises and encourage them to stay consistent. In addition, we ensure that treatment areas are clean and organized. Essentially, the role is to make therapy sessions effective, safe, and motivating for every patient. 4. What qualities make a good physiotherapy assistant? Highlight both technical and soft skills. A good physiotherapy assistant needs empathy, patience, and strong communication skills. Patients may be in pain, frustrated, or anxious, so showing compassion and encouragement is key. Attention to detail is also crucial when following a physiotherapist's instructions or monitoring progress. Physical stamina, professionalism, and teamwork are equally important, since the role can be physically demanding. Most importantly, reliability and a genuine interest in patient well-being make an assistant truly effective in their role. 5. How do you motivate patients during difficult therapy sessions? Employers want to see emotional intelligence. I motivate patients by setting achievable goals and celebrating small victories along the way. I always maintain a positive tone and remind them how far they've come rather than how far they still need to go. Sometimes I use humor or share success stories to lift their spirits. I also listen to their frustrations, showing empathy while gently encouraging them to push forward. Every patient's journey is different, so I adapt my approach to their personality and needs. 6. How do you handle a non-cooperative or unmotivated patient? Show calmness and professionalism. If a patient is unmotivated or resistant, I first try to understand the reason behind their behavior, whether it's pain, fear, or frustration. Then I communicate patiently, addressing their concerns and adjusting the treatment pace if needed. I explain how each exercise contributes to their recovery to help them see the value. Maintaining respect and patience is essential. Forcing progress never works. Encouragement, empathy, and small milestones often help rebuild trust and motivation. 7. How do you ensure patient safety during therapy? Show responsibility and awareness. Patient safety is always my top priority. Before every session, I check that equipment is in proper working order and that the environment is clutter-free. I assist patients in getting on and off tables safely and closely monitor them during exercises to prevent falls or overexertion. I also follow the physiotherapist's guidelines carefully and report any signs of pain or distress immediately. Communication, vigilance, and maintaining proper technique ensure every session is both safe and effective. 8. What experience do you have working with physiotherapy equipment? Mention hands-on familiarity. I've worked with various physiotherapy tools such as resistance bands, exercise balls, parallel bars, ultrasound machines, and TENS units. I'm comfortable setting them up, cleaning them after use, and ensuring they meet safety standards. During my clinical training, I also assisted with hydrotherapy sessions and mobility aids. I'm always careful to follow protocols when using electrotherapy or manual therapy tools. I take pride in keeping equipment ready and in excellent condition for each treatment. 9. How do you document patient progress? Show attention to detail and confidentiality. I accurately record each patient's performance, noting improvements, difficulties, or pain responses during sessions. This helps the physiotherapist adjust treatment plans effectively. I also ensure that all documentation follows privacy and data protection standards. I'm familiar with both handwritten and digital record systems, including EMR software. Clear, timely documentation is critical not only for continuity of care but also for ensuring accurate communication within the healthcare team. 10. How do you handle confidential patient information? Demonstrate ethical awareness. I strictly follow confidentiality and data protection policies. I never discuss patient information outside authorized medical staff, and I ensure that written or electronic records are stored securely. In a healthcare setting, trust is essential, so maintaining patient privacy is a non-negotiable part of professionalism. Whether it's physical records, online data, or verbal communication, I treat every piece of patient information with utmost discretion and respect. 11. How do you deal with stressful or busy workdays? Show calm and organization. Physiotherapy environments can be fast-paced, especially when multiple patients require attention. I stay organized by prioritizing tasks and maintaining a calm mindset. I also communicate with the team regularly to ensure we're all aligned. If stress builds up, I take short mindful breaths or quick breaks when possible. I've learned that preparation and teamwork reduce stress significantly. Staying patient-focused helps me manage pressure and deliver quality care regardless of workload. 12. Describe a time you worked in a team. Demonstrate collaboration and reliability. In my previous role, I worked closely with physiotherapists, nurses, and occupational therapists in a rehabilitation center. We coordinated treatment schedules for post-surgery patients. I ensured each patient completed their exercise routines on time and updated the physiotherapist about their progress. Through clear communication and flexibility, we reduced waiting times and improved overall patient satisfaction. It taught me how teamwork directly impacts recovery outcomes and the overall efficiency of the care process. 13. How would you handle a patient who complains about pain during therapy? Empathy and adaptability matter. If a patient reports pain, I immediately stop the activity and assess the situation. I ask specific questions about the pain's location, intensity, and nature. Then I report it to the physiotherapist before continuing. Sometimes mild discomfort is expected, but severe or sharp pain needs immediate attention. I reassure the patient, maintain a calm environment, and never push them beyond their limit. Patient trust and safety always come before completing a session. 14. What would you do if you disagreed with a physiotherapist's instruction? Show respect and professionalism. If I ever had concerns about an instruction, I'd approach the physiotherapist privately and respectfully to discuss it. I would share my observations or concerns without being confrontational, seeking clarification first. The physiotherapist has ultimate responsibility for the treatment plan, but open communication ensures the best outcomes. I believe in addressing disagreements constructively and maintaining a positive professional relationship built on trust and mutual respect. 15. How do you stay updated with physiotherapy trends or practices? Show enthusiasm for growth. I believe continuous learning is essential in healthcare. I stay updated by attending workshops, reading professional journals, and following reputable physiotherapy organizations online. I also learn from physiotherapists I work with by asking questions and observing their techniques. Keeping up with new rehabilitation methods, exercise science, and assistive technologies helps me provide the best support possible and ensures my skills remain relevant and effective. 16. How do you prioritize your daily tasks? Demonstrate time management. I start by reviewing the day's schedule and patient list, noting which sessions are most time-sensitive. I prepare equipment in advance and communicate with the physiotherapist about any special needs. I handle documentation between sessions to avoid delays. When unexpected situations arise, like emergency patients, I adapt quickly while keeping patient care at the center. Organization, preparation, and flexibility are key to ensuring everything runs smoothly. 17. How do you handle feedback from your supervisor? Show openness and professionalism. I always appreciate constructive feedback because it helps me improve. If my supervisor points out something I can do better, I listen carefully, ask clarifying questions, and apply the suggestions right away. I see feedback as a learning opportunity rather than criticism. In healthcare, reflection and improvement are part of professional growth, so I make it a habit to review my performance regularly. 18. What would you do if a patient refused treatment? Show patience and ethics. If a patient refuses treatment, I remain calm and respectful. I try to understand the reason, whether it's fear, pain, or misunderstanding. I explain the benefits of the therapy and address their concerns clearly. However, I never force participation. I inform the physiotherapist and document the refusal appropriately. Patients have the right to make their own decisions, and it's important to handle such situations with empathy and professionalism. 19. How do you handle multiple patients at once? Show multitasking and focus. When managing multiple patients, organization and time management become essential. I ensure each patient gets individual attention by preparing materials in advance and keeping communication clear. I stagger activities so no one is left unattended. I remain focused, calm, and always aware of safety. Coordinating with the physiotherapist also ensures smooth transitions. The goal is quality over quantity. Every patient deserves attentive and compassionate care, even during busy hours. 20. Describe a challenging situation and how you handled it. Show problem solving and composure. Once, I worked with a post-surgery patient who was extremely anxious about movement. During one session, he refused to continue. I calmly reassured him, adjusted the exercises to a simpler level, and celebrated each small step. Over time, he gained confidence and completed his program successfully. The experience taught me that patience, empathy, and flexibility are vital in physiotherapy. Building trust can transform even the most resistant patient's attitude toward recovery. 21. What are your strengths as a physiotherapy assistant? Highlight relevant traits. My greatest strengths are empathy, communication, and reliability. I connect easily with patients, making them feel safe and supported during therapy. I'm attentive to details, ensuring exercises are done correctly and safely. I'm also dependable. My team can count on me to be punctual, organized, and proactive. These qualities help create a smooth, positive environment that supports both patient recovery and the physiotherapist's workflow. 22. What are your weaknesses, and how are you improving them? Show honesty and growth. One area I've been improving is my speed with electronic documentation. Initially, I focused more on patient care than data entry, but I realized that accurate, timely records are vital. I've since practiced using different EMR systems and created templates for efficiency. I now manage to balance both patient interaction and administrative duties effectively. I view every weakness as a chance to grow into a more capable professional. 23. How would you handle a patient from a different cultural background? Show sensitivity and inclusiveness. I respect every patient's culture and beliefs. If language barriers exist, I use simple terms, visual cues, or translation support. I also remain mindful of cultural preferences regarding touch, gender interaction, or personal space. By showing respect, listening attentively, and adapting my communication style, I build trust and ensure that every patient feels comfortable, valued, and understood throughout their treatment journey. 24. Why should we hire you as a physiotherapy assistant? Summarize your value. You should hire me because I combine strong technical skills with genuine compassion for patients. I bring hands-on experience assisting physiotherapists in diverse settings, from orthopedic recovery to elderly care. I'm reliable, adaptable, and eager to learn new techniques. I take pride in creating a motivating, safe, and positive therapy environment. Most importantly, I'm passionate about helping people rebuild strength, mobility, and confidence. That's what drives me every day. 25. Where do you see yourself in the next 5 years? Show ambition and commitment. In 5 years, I see myself as an experienced physiotherapy assistant who has developed strong expertise across different patient types. I'd like to continue growing in this field, possibly specializing in sports rehabilitation or neurological recovery. I also hope to mentor new assistants, sharing what I've learned. My long-term goal is to keep improving patient care quality and contribute positively to a respected healthcare team. And that wraps up our list of the top 25 physiotherapy assistant interview questions and answers. Remember, preparation, confidence, and empathy are the keys to success in this field. Rehearse your answers, understand your motivations, and always keep patient care at the heart of your responses. If you found this video helpful, don't forget to like, share, and subscribe for more interview tips and career guides. Good luck with your interview. You've got this.